Hi everyone, I'm Nicole Turnbull, CEO of the Psychosocial Safety and Leadership Institute, and I am really excited to be chatting with Sarah from Psychgroup today. We're going to have a chat about who Sarah is, what Psychgroup offers, why this work matters, and how you can connect with her if you'd like to learn more. Sarah, thank you so much for being part of the collective and welcome.
Thank you. Thanks for having me, Nicole.
You're welcome. And look, for people who might not have met you before, can you tell us a bit about yourself and your background?
Yeah, so I'm a registered psychologist and I have a background in injury management. So my early career as a psychologist was in injury management for psychological injuries.
Mm.
So supporting injured workers that had sustained psychological injuries during the course of their work. So some examples, I worked with the Australian Federal Police, also with large government entities. So understood a lot about, how psychosocial hazards show up in the work environment and also
Mm.
how they lead to harm. So, super passionate about that space and, supporting the I guess health and well-being of our workforce.
And it is so great to have your knowledge and skill set in the collective. This is what it's all about, right? Working to our strengths and supporting each other. So, yeah, again, thank you.
Oh, no, you're welcome. Thank you.
And so, what is Psych Group and what do you offer there?
Yeah, so Psychgroup is an organisation. We're built of a number of different professionals, so organisational psychologists, clinical psychologists, general psychologists, and also professionals that have a work health and safety background.
Mm.
So we support organisations to, I guess, comply with the new psychological health regulations across the nation, but we do that in a real practical and easy to understand way. So myself, I have a compliance background. So not only did I work in injury management, worked in consulting myself, but then also went to work for the regulator in Victoria.
Mhm.
I was an appointed inspector and also helped the inspectorate to I guess, conduct psychosocial inspections.
Mhm.
I guess what makes us a little bit unique and different is that we bring that regulatory expertise to the mix. So we partner with regulators as well as, partnering with organisations to help them to, build compliance. But
Mhm.
as I said, in a really, I think a lot of the information is super technical,
Yeah.
and it's a bit to get your head around. So we distill down that noise and really help to support and build capability and confidence internally.
Yeah, and that's totally what we're about as well. But you've been on the inside,
Yes.
like a few of us.
Yeah.
Uh, and while it would be great for harmonization, it hasn't happened yet. So
No,
to
that's
have
right.
the different knowledge and experience is really great. And totally hear you when it comes to that interpretation of the legislation. And
Yeah.
organizations really want to know what to do, but it's quite technical and can be quite legalese. So
Yeah.
it's, yeah, great to have
Yeah.
that view.
Yeah, exactly. And I think that's what employers are asking for. They just want help,
Yeah.
in terms of they've either received an improvement notice or they want to build infrastructure or they've done a risk assessment and they don't know what to do with the data or they want to train their leaders. So we just come in and help, I guess, walk the line of the organization of, what they're wanting support with at any given time. So, yeah.
Yeah. And why is this work important to you?
I think prevention is my passion, right? So I think, and that stems from my earlier experiences of a psychologist seeing those injuries and seeing the actual devastation and the effect on people's lives and livelihoods. So a worker as young as, 27 not being able to work again
Mm.
because they had sustained such a profound injury and that it could have actually been prevented.
Yeah.
So even though we're exposed to things like trauma and violence and aggression, for example, in the emergency services setting, how can we actually build safer and more constructive workplaces? How can we start to talk more about these risks as a normal part of the role and building infrastructure rather than just assuming a person's not tough enough for the role? So that's the old school and outdated thinking.
Mm.
And so we're really about prevention first.
Mhm.
And it's really thinking, well, where there are risks that are inherent in roles, we need to design the roles better. And we
Yes.
need to provide more management infrastructure to support those roles. So, I think first and foremost, we want to prevent injuries from occurring. And we do that by, understanding the work context, the work design, and the systems, and
Mhm.
then create that kind of infrastructure to support and bolster people where ultimately they can thrive, right?
Yeah.
So that's my passion, and that's kind of where we start.
And workplaces want that as well. They just have no idea where to start because safety is just one aspect of running a business, and
Yeah,
psychosocial safety is just one aspect of safety. So there's so
100.
much to do. It can get really unmanageable. So to get the support of someone like you, I think is so valuable.
Oh, thank you.
And what kind of organizations and leaders do you enjoy working most with?
I think leaders that are inquisitive
Mm.
and curious about this space, where they see they might have a role to play.
Yeah.
So I think, where there is more opportunity for engagement and learning is where there is a curiosity in terms of, well, look, this might not be my strong suit, and I might never have heard about this before or even had conversations with my staff like this before, but how might this look? And how might it feel if I gave it a go? What might be the outcome? If I had a conversation or lent into a conversation that's a little bit uncomfortable, that leads to better outcomes in terms of understanding what in the work environment is not working and how can I support as a leader, well, then that to me is just gold, because you're going to get the best outcomes, not only for the people, but also the organization.
Mm.
Those leaders are going to then build from the ground up, what good risk management practice looks like as well, because they're kind of feeding in to the system improvements. So,
Yeah. Yeah,
yeah,
exactly. And I
yeah.
know that there'll be people listening to this going, how do I contact Sarah? So what's the best
Uh,
way for them to connect with you and learn more?
Yeah, look, we're always happy to have a chat with anyone, and
Mhm.
we're really, pleased to be part of this collective. The I guess pursuit around providing easy to access information that is not costly and solves problems for people. So that's our aim first and foremost. So we can be contacted obviously through LinkedIn, Psychgroup by LinkedIn, our website, obviously psychgroup.com.au. We have a number of different means. You can obviously, call us. You can get in contact via our form, or you can book a consult.
Yeah.
So myself and our other principal psychologists are available for a consult, and that's a free opportunity to be able to connect with us, talk with us about your problems, and just receive some, timely support if that's all you're looking for at that time. So hopefully, yeah, that's a good support for the industry at the moment.
Yeah, definitely. And we will include all of those links so that it's easy for people to access as well. But just
Awesome.
wanted to say again, a huge thank you for being part of the collective. Together we are stronger, and it's incredible people like you that add value to the work that we are all doing to raise the bar for Australian workplaces. So thank you again.
Oh, you're welcome, Nicole, and thanks for having me.
You're welcome.